Welcome to Public Forum, a community outreach program produced at North Idaho College on the shores of Lake Coeur d'Alene. Featuring guests from around the globe addressing a wide variety of subjects, Public Forum serves to educate and enlighten. Please join host and moderator, political scientist Tony Stewart, in welcoming today's guest.
I am most pleased to welcome you to part 2 of a 2-week series. And for our good viewers who were not with us last week, our guest was here to talk about dental issues and dental health and care. And we're delighted to have her back. I just really enjoyed last week because I learned so much. I welcome Sherry Williams. She is highly qualified to address this question. She worked for 8 years in California as a dental assistant, and then she came to North Idaho where she received her AS degree at North Idaho College, and then her Bachelor of Science in the field from Eastern Washington University, where she now teaches and has been teaching for the past 23 years, dental hygienist or the future hygienist. In addition to that, for 23 years, she's also been in private practice. I'm also impressed, and we'll deal with that on the show later today. She's also invented something for both dentists and the hygienists and other staff that is a really breakthrough in dental care. At the end of last week's program, Sherry, we were talking about dental care for prevention of decay and problems, and we got to the point, I was going to pick up where we left off, that you're trying to make sure you take really good care of your teeth, and we talked about brushing, which everybody knows about. We talked a lot about even small children or babies and how you can enhance their care through certain intake. Let's just back up enough for our new viewers to talk a little bit about the babies or children from 6 months to age 14. What can they do, parents?
Lots of things. They can make sure the child gets in regularly, starting at whatever age the child is comfortable sitting in a dental chair. Sometimes their first visit is at 2 or 2.5 or 3, and they just play in the chair, and we give them a ride up and down in the chair and squirt the squirt gun in their mouth and all of that to get them used to the people that are there and the environment and the noises. They can, of course, brush the child's teeth, and they should brush the child's teeth at night before they go to bed themselves, just to make sure all of the plaque and bacteria are off and the little bits of food. And they can not put the child to bed with a bottle of anything but water. It would be show an amazing decrease in decay in children's mouths. One of my own grandchildren, I have had my fingers in her mouth since she was about 3 months old, getting her used to that. And one day she just walked over to a little box that I keep my flossing things in and picked up my little flossing device and started flossing her own teeth. So learning by example is a good way to teach small children. Having regular checkups with fluoride treatments that are atopical, that coat the outside of the tooth and don't require systemic intake is a wonderful thing. There are sealants that are like painting white fingernail polish on the chewing surface of their permanent molars and premolars. Those have decreased incidental caries by a huge amount, just by simply sealing out the bacteria that goes into the mouth every day through the food.
Last time for adults we talked about, of course, brushing if you can 3 times or at least twice, morning and night. Also, flossing is just really a major thing. In addition to flossing, depending on the challenge, some teeth are much more challenging than others, and the area between teeth and all is a problem. In addition to those 2 things, brushing and flossing, what else can adults do? And get a lot of this from their dentist and advice.
Sure. I don't know if this is the general philosophy, but this has been my philosophy that's been successful to my patients and my family. There are little devices that have floss on the end of them. They're kind of a C-shape. Some of them are called dental picks or dental swords. They look kind of like the little things that you stab cocktail olives with. They have a pointed end, a tapered end, and then floss on the other end. And you can floss your teeth and then turn it around and use the little tapered toothpick to go in between each tooth, which keeps the gum tissue exercised, for lack of a better word. It keeps the gum tissue tight. It keeps it low around the tooth. The normal healthy relationship between your gums and the bone that holds your gums in is 1 to 3 millimeters. If you get the numbers that the hygienist calls out, hopefully every time you're in the dental chair, and writes them down, the probe depths, or the pockets as they are commonly called, if they get above 3 millimeters, then your conventional floss doesn't work, and your conventional toothbrush doesn't work, because they both reach a maximum of 3 millimeters. So the stimulation between the teeth with the tapered end of something, they have plastic toothpicks, with floss, as I just alluded to. They have the little brushes.
Brushes on them?
Mm-hmm. Well, the little brushes will only reach 3 millimeters.
Okay.
But something that actually physically stimulates the gum tissue, and we're talking about adults' mouths, not children's mouths, will actually cause the tissue to tighten against the tooth and draw down closer to the bone.
If you have your teeth cleaned often, that'll tighten them up. I noticed that.
Yes, it does.
That makes a difference. Also, my dentist talked to me about there's some products out, the electric toothbrushes, I guess you'd call them, and that's mostly for massaging the gums.
Well, yes and no. There are electric toothbrushes, which were way back when. Now we have battery operated, of course. And then they have the sonic brushes. Oral-B makes one. Philips makes one called Sonicare. There are a number of ultrasonic brushes that extend, because they vibrate so quickly, they extend the cleansing area by 0.5 millimeter. So you can reach up to 3.5 millimeters with those. But you still can't reach 3 millimeters below the gums with floss. So you need to make the gums go down, or get your teeth cleaned often enough that the gums will be tight, and take care of the periodontal disease.
Some people are born with perfect teeth. They're blessed.
Yes.
Everyone is not treated the same by nature. And so in some of those cases, and because things are not as likely to get deep in the gums, they probably need to go to a hygienist every 6 months or once a year. Is that right? And others need to go on a very regular basis.
Depending on the host response of the body, yes, there are systemic diseases that can cause you, as a young person, to have to go more than once a year or twice a year. Twice a year, I should say. I don't want to say once a year. Twice a year is the norm. And what you can expect if you take care of your teeth routinely and floss and brush at least once a day and brush 2 or 3 times a day, the important time being at night. But I just lost the question.
But my point was that how often you'd have to go, and you answered that. But there's some people with, maybe it's a maintenance problem, or maybe it's just the formation shape of the teeth. So there are a lot of people who need to go every 3 months. That's
right. That's when periodontal disease has been diagnosed. That's when the bacteria is winning, and you're not. The bone level of the bone holding your teeth in the jaw bones will drop. It will be decimated. It will be caused to resore because of the bacteria that is particularly virulent after 3 millimeters. It doesn't need oxygen to grow, and therefore it is more potent or more toxic to your body.
We also talked last week that in addition to the regular cleaning, and there's 2 methods there, I guess. The older method where you take an instrument and you just drill down. I mean, you just
Scrape.
scrape as it were down in there. And then there's a newer method. Is that what's catching on the most?
It is catching on. It's an ultrasonic instrument that you insert a tip into this device that vibrates ultrasonically 44,000 times a minute and squirts water to keep the tip cool. That's the reason for the water. And they have been improved and re-improved and refined and re-refined to the point that they can be, in some people's hands, as effective as the old method of using the scraping.
But the scraping is more effective in most cases, or not?
I've only been a hygienist 23 years, so I don't think I'm good enough to do one or the other. I use them in conjunction with each other.
You do both.
I do both.
Now we're going to turn to your invention, Sherry. Okay. First of all, we have it here. There it is. Would you take this and show us what you've invented and why?
Well, these are called Chubbies instrument grips. They're 1.5 inches long, and they're a 1/2 inch in diameter. And what they do, they go over the hand instruments, such as this one here, there. And they make the barrel of the instrument or the handle of the instrument a 1/2 inch bigger around. They're all the same size, and they will stretch to fit over literally any dental instrument in the office, including forceps that nobody likes to think about to take teeth out with. And the reason they were developed was because I had carpal tunnel problems.
And a lot of people do that work with something like that daily.
Yes, dental hygienists are one of the highest groups that will develop carpal tunnel symptoms, at least, in the lifetime of their career. And what this allows you to do is open your hand. Can you see that?
Yes.
You can open the hand 1/2 inch larger around.
So it
more
doesn't
protection. Squeeze. Yes, and it also, with this wonderful material, which is rubber silicone, it creates a non-slip surface, so the clinician doesn't have to squeeze so hard on the instrument to have control. As a matter of fact, by squeezing less, you get better control.
It's very smooth, and also like working water or whatever in the mouth, it can slip real easily. I would suspect, too, that since you have better control, there's less likelihood of injury to the patient.
Yes, to the patient and the clinician. I can't tell you how many clinicians will put their other finger in to protect the patient's lips or tissue and end up poking themselves. So this little device allows you to slip less. It allows you to hurt less. It allows you to work longer without your hands becoming fatigued, because dental hygiene is a very physical process that you need to use a lot of power with.
It's a long day, too,
Yes.
if you have a lot of patients. And you invented this. And
yes,
now
I did.
You have a company that is distributing this for you?
Yes, up until now, I brought this out on market myself in the middle of 1999, and I have been trying to market it myself, which is a very expensive process to do. But I have taken them to area dental hygiene schools in California, Oregon, New Mexico, Idaho, all over the place, and to dental hygiene conventions to exhibit them. And probably in 6 years, I've had 10 people tell me they didn't like them. And now I have...
10 didn't, but there are many.
Many, thousands, yes. I've sold thousands of these. And they're double-ended. You put one on each end.
It'll show it again.
Okay.
There you go. Yeah.
Okay, one on each end. This one is already on the
We need to pull it more far this way. There we go.
There we go. One is already on the instrument, and then the other you can put over the tip and slide it down. But you need rubbing alcohol in this to release the surface tension. And then when the alcohol evaporates, it stays there, and it works like magic.
Now, when you are, you're very careful about.
Yes, I am.
Not only you, but about, cleaning all instruments and all. Can you clean those instruments with those on there? Do you have to remove them?
No, you don't have to remove them, and that's the nice thing about it, because you leave them on there. The rubber silicone is a medical grade that they use in hospitals in surgeries. Because it is silicone, nothing sticks to the surface, and because it is as dense as it is, none of the bacteria or virus spores can penetrate it. So you can cut one of these off if you like, or take one off after 6 months or 6 years of use, and you'll still find a clean, shiny surface inside.
But when you do the actual cleaning of the instrument, anything that go on the surface there, it would clean it off.
It cleans it off. It cleans it out. And it is heat sterilizable up to 600 degrees, which dentistry is around 345, I believe.
Yeah.
So anything but an open flame, you can clean it in, and it won't hurt it.
And like we said, you have a company now that,
Yes.
and they sell all kinds of equipment, so they're selling your invention here.
Yes, they are. I've just licensed this product to a company out of North Carolina. Can I say the name?
Yes, you can.
Okay, Practicon Incorporated. I'm sure they'll appreciate me mentioning that. We have just closed on them licensing my product for 3 years, and they will be the exclusive distributors. I believe my manufacturer here in Athol will still be the manufacturer, and hopefully they'll sell and help more people.
Now we're going to ask them to put up on the screen a contact number, or I believe you that you gave our staff beforehand. And I believe they have both a telephone number and also, is it a website?
Website.
Yeah. Would you also, for those who might not be
email.
watching the screen, give them that number, please?
The home number is 208-664-2521. Right now, I still have an 800 number until.
Well, by the time this show airs, it may not be. We're taping
it may not be, right.
It'll air in March.
Right.
And so.
And my email is handtech2000@yahoo.com. And I probably will not maintain my website, which is up and running right now, because hopefully Practicon will have transferred all the business over.
But dental people who want to have contact with this, of course, you could get them in touch with that company.
Oh, absolutely.
Or they could call the company directly.
Yes, or they can call the company. Practicon has a website. It's practicon.com, and they can search through the pages and look it up that way. But anybody seeing this or hearing this, I would be happy to put them in contact.
Well, I know you said you'd use this equipment, you have the problem with your hands and all. You're a very bright person. I've always admired people who are inventors or people who can write great books or poetry.
So do I.
Yeah.
Mine was by need.
How did you figure this out? I mean, it takes such a creative mind to do it.
In years past, my students have always said, boy, when I do this, I'm going to invent this and that and the other. And I've always thought, I don't think I could ever think of anything to be invented. And this, because I ended up with having carpal tunnel surgery on both hands and 2 other surgeries that have to do with the thumb, was kind of like necessity. And I had a wonderful captive audience with my students, and they were very, very supportive, and some hygienist friends around here who I knew that were having same and different problems, but all had to do with hand fatigue. The first ones that the designer who designed them for me, he cooked them up with some kind of tubing and super glue and boiling water. I thought they were the most beautiful things I'd ever seen, and now I look at them and I think, oh my gosh, what a transition. But I listened to what the hygienist said. They wanted something that could be sterilized. They wanted something with longevity, because a lot of things have, it seems, planned obsolescence.
And then Also, like you said, something that wouldn't stick to certain things.
Right.
So how did you discover that particular material that would be the proper for this?
The gentleman that designed them for me, bless his heart, knew of a manufacturing company in Athol that was using this particular kind of material, rubber silicone. And he was one of 2 people in the western states at the time that was using it. He needed customers because he had just started up, and the designer put them together. He and I together. They worked out all of the fine mathematical details. I told them how long I needed them to be and how wide I needed them to be. And within 2 months of the first meeting, we had these out on the market, and it was a huge leap of faith for me and my husband.
Yes. And for you who don't know, Rollie Williams is her husband, and he taught and coached at a college for many years, 36 years, right? And wonderful, wonderful human being, Rollie Williams is too. And so it all ties together because this is all about education, and you have your students and classes.
Yes, it is.
And you have little grooves in those.
I have little grooves that make them a little spongier, so that the dental hygienist can actually have a little give instead of holding on to hard stainless steel.
And it also easier to hold with those grooves in
Oh,
there.
much easier. When the hygienist is taking your numbers of your teeth, your pockets, if she has one on her probe, you can hold it more lightly, therefore you hold it with less pressure, and you don't push with as much pressure. Yeah. It's much, there's lots of benefits for everybody.
You know, you're going to save a lot of people from some pain and surgery.
I hope so. That's
another humane reason for doing it. We have some time left. I don't want to end the program without talking about your students. That's always very important.
I love my students.
Yes, and so you take them through you have a part of the program they go through. I think the best way we might help is for individuals who are considering becoming a student in the program. What advice do you have them? What kind of courses they have to take, and what is the curricula for them?
Most courses the curriculum is already laid out in bachelor's degrees. I am somewhat familiar with associate degrees. That takes 3 years to get through. Bachelor's, of course, are 4 years. You have to take chemistries, which I avoided like the plague all my life till I decided to do this. You have to take chemistries, microbiology, anatomy, and physiology, essentially the same thing that the nursing students do.
And so a good math background is necessary towards the chemistry.
Yes, it is, and I don't know how I got in.
Because chemistry is so based on that
Chemistry is black and white. There's no essay questions in chemistry.
But math is helpful.
Math is helpful. There are any student that is thinking of pursuing this career. Men are pursuing it more often now. We're seeing more men in the program. Needs to contact a dental hygiene program or 2 and get the curriculum that they can follow at their college.
Here in the Northwest, other than Eastern Washington University, what are some other institutions that have the program?
Yakima has a program. Columbia Basin has a program. Idaho has a bachelor's program, a highly thought of bachelor's program down at ISU in Pocatello. And there is a proprietary program in Boise that gives you a certificate of dental hygiene.
We also go over to Montana.
Carroll College in Montana, I believe one of the 2 universities, and I think it's the one in Bozeman.
Montana State University.
Has a dental hygiene program. There are more associate programs than there are bachelor's programs, but the move in dental hygiene is to the master's degree level and then the doctorate. You can teach clinical dental hygiene with a bachelor's degree, which I have. You can't teach the didactic courses without a master's at least. ISU has begun a master's program in dental hygiene. They're just online this quarter, and there are 2 or 3 people from up here that are taking that master's program. There's a advanced dental hygiene practitioners classification that is a nationwide movement to give dental hygienists the same degree of access to patients as nurse practitioners have. It will be an advanced degree.
And they could even provide prescriptions.
Yes,
and all that.
yes, that's kind of in the very infantile stages of it, but there are conferences all over the United States that are meeting to discuss this very thing, and that would be a wonderful, wonderful.
So they're going to wind up in school as
feather
long
in
as
the hat.
dentists.
Yes, just about, as long as physical therapists anyway, and nurse practitioners.
Okay. Now then, among the things they do in getting the bachelor's degree is, of course, there's lab work. Tell us a little bit about some of the lab work they do.
Well,
do they practice on one another?
Yes, they do. First, they practice on a thing called a dentoform or a typodont. It's a set of teeth, of plastic teeth, set in rubber gums that is attachable to a device on a chair, so it simulates working on people. And then after they've had enough practice and enough supervision with that, they will graduate to working on each other. And our program at Eastern Washington, where I teach, is a 3-year program. The first year, if you're accepted into the program, is about 30% dental hygiene classes and the rest for your bachelor's requirements. And then it's about 60% in your third year and 100% in your third year, excuse me. So basically they start as sophomores because they've had to take their prerequisites. We've got some wonderful technology that I've been dying to tell people about. It's a fiber optic technology that's been out for about 8 years, and it actually allows you to put a very, very tiny instrument about 1 or 2 millimeters under the gums of somebody that has a deep pocket, and it allows you to see. It has a camera, a light, and water.
That's
and
wonderful.
You can actually see it.
I wish we could continue. Sherry, it's been wonderful having you here this 2 weeks. It's been very, very informative, and it's good to hear that because that'll even be more preventive
Yes.
through that kind of equipment to use to help people with their care.
Pain-free.
Yeah. Ladies and gentlemen, I hope you've enjoyed this program the past 2 weeks as much as I have. And until next week, I hope you have a good week. We'll turn to another subject then. And until then, please have a good week. I am Tony Stewart.
Thanks.
Recorded on the campus of North Idaho College, Public Forum is the longest-running in-house college production on PBS. Each episode is pre-recorded live and is an educational outreach from North Idaho College. Please join us at this same time next week for another edition of Public Forum on this public television station.